How to choose the right intervention for an individual with substance use disorder. Addiction is a disease that affects both the individual with substance use disorder and their loved ones. It's often hard for family members to know how best to help an individual with substance use disorder, but there are a variety of interventions that can be used depending on the severity of the addiction. If you have a loved one who needs help with addiction, it's important to remember that they need your support and understanding more than anything else. But if they don't get the help they need, substance abuse will destroy them. The sooner something is done about addiction, the better chance someone has at recovery. If you suspect someone close to you might be struggling with substance use disorder, it's important for you to remember that they need your help more than anything else. What is an intervention and why do individuals with substance use disorder need them? An intervention is a process where friends, family, and/or professionals confront an individual with substance use disorder about their addiction and urge them to seek treatment centers. Individuals with substance use disorder need interventions because they often do not realize they have a problem or are in denial about the severity of their addiction. An intervention can be an effective way to get an individual with substance use disorder to see that they need help. The different types of interventions that are available. A few different types of interventions can be used when helping an individual with substance use disorder. The most common type is the family intervention, which is when the family and friends come together to confront the individual with substance use disorder about their addiction. Another type of intervention is the professional intervention, which is when a professional such as a therapist or counselor helps to guide the conversation and confrontation. The third type of intervention is peer intervention, which is when an individual with substance use disorder confront other individuals with substance use disorder about their drug addiction. No matter which type of intervention an individual with substance use disorder goes through, it is important for those around them to support and encourage them as they work towards recovery. The stages of intervention. Interventions are typically staged to ensure that they are as effective as possible. There are typically 3 stages of intervention: pre-intervention, intervention, and post-intervention. Pre-intervention is when the individual with substance use disorder first contacted and informed about the intervention. This stage is important because it allows the individual with substance use disorder time to prepare for what is going to happen. It also gives them a chance to get help if they need it. The intervention stage is when the individual with substance use disorder meets with their family and friends. This is often a very emotional meeting, and it can be difficult for everyone involved. However, it is important that this meeting take place so that the individual with substance use disorder can understand how their addiction has affected those around them. The post-intervention is the final stage, and it takes place after the individual with substance use disorder has either decided to go to rehab or not. This stage is important because it ensures that the intervention is only a necessary last resort. Sometimes an individual with substance use disorder will refuse treatment initially, but then realize how badly they need help later on. The post-intervention allows time for this realization to happen. Choosing the right intervention for an individual with substance use disorder. When it comes to choosing the right intervention for an individual with substance use disorder, there are a few factors to consider. The first is the individual's specific needs. Every individual's is different, and so each intervention must be tailored to their individual needs. The second factor to consider is the individual's level of addiction. Some interventions are better suited for more severe addictions, while others are better for milder addictions. The third factor to consider is the individual's environment. If the individual with substance use disorder is in a supportive environment, then a less intensive intervention may be successful. If the individual is in an unsupportive environment, then a more intensive intervention may be necessary. Ultimately, the best way to choose the right intervention for an individual with substance use disorder is to consult with a professional. They can assess the individual and determine what type of intervention is best for them. What happens after an individual with substance use disorder agrees to go to rehab? After an individual with substance use disorder agrees to go to rehab, they will need to follow through with their commitment. This means attending all of their appointments and committing to the treatment plan. Rehab can be a difficult process, but it is often the best chance an individual with substance use disorder has at recovering from their addiction. With the right support, they can overcome their addiction and get back to living a healthy life. In order to make sure that a rehab center is a right fit, an individual with substance use disorder will need help from their loved ones. If they have been using drugs or alcohol for some time, their entire life may already be centered on making money to buy more of their drug of choice and maintaining their current pattern. This means that their family members and friends need to step in and take care of them as they look for treatment. How family and friends can support an individual with substance use disorder during rehab. You can provide a great deal of support for your loved one before his or her arrival, while he or she is at treatment, and after their release from a drug rehab program by following these steps. Keep lines of communication open, be understanding and non-judgmental. Don't enable your loved one's addiction by buying them drugs, giving them money, etc. Offer to attend doctor's appointments with your loved ones during treatment so they don't feel alone. Ensure that your loved one has transportation during and after treatment. Offer to attend family meetings with your loved one's rehab team so everyone can be on the same page about his or her recovery plan. Make sure they have a strong support system at home, including friends and family members who will help them through their journey to sobriety. What to do if the individual with substance use disorder relapses after treatment. Your loved one may have gone through drug rehabilitation, but they are not cured of their addiction yet. It's important that you continue to support them for as long as they need it, which could be many months or even years depending on your loved one's situation. The process of helping your loved one recover from addiction and rebuild their life requires patience and commitment. Here are some things you can do. Take steps to prevent your loved one from falling back into substance abuse, such as taking over their social life so they don't feel tempted by old friends who want them to fall back into old habits. Make sure your loved one is otherwise occupied, such as through continued treatment, including counseling and support groups, school or employment. Familiarize yourself with drug and alcohol abuse signs and symptoms, and keep an eye out for them. Be honest about how you feel if any suspicions arise. Keep in touch with your loved one's treatment team so you can discuss any problems or concerns. Support your loved one unconditionally. You don't have to agree with every decision they make, but always offer love and support as they work through their recovery process. How to help an addict who relapses after rehab. If your loved one relapses after going to a drug or alcohol treatment program, you should consider it a slip-up and not the end of their recovery process. Help your loved ones pick themselves back up by following these steps. Remain supportive and loving by offering unconditional love and reassurance that you still believe in them. Work with your loved one to develop a new treatment plan that addresses what went wrong before and helps them avoid the same mistakes in the future. Find out why your loved one relapsed, if possible. Was it because of stress, boredom, or outside pressure? And plan ways to cope with their triggers so they don't fall back into old habits in the future. If your loved one was using drugs or alcohol to cope with emotional pain, work with them on healthier forms of coping before they relapse again. Continue to encourage your loved one to get counseling, attend support groups and meet regularly with their treatment team so they can get help before a slip turns into a full relapse.